Would you say there is a group of people that EBOO doesn't work, or you can do EBOO for everyone?
Yes, there are like some specific conditions where we don't recommend to do EBOO.
Okay.
If there's uncontrolled metabolic dysfunction, there's already too much oxidation happening in the body. So if we do it, we're gonna exacerbate the effect of what's happening in their body. So we better control first metabolic dysfunction, and then we start doing the EBOO procedures. Patients that have epilepsy, for example, it also, the oxidation process, it can also trigger episodes, so we don't do it. People that have G6PD deficiency, this is very important because this is very common in our region. G6PD deficiency, it's an enzyme that is produced by the red blood cells. If they don't produce it, they literally rupture because of the stress generated by the ozone therapy. So that's why we always do a blood work beforehand, so that we can understand if you produce these proteins. And we also want to see if you're not anemic. So also people with anemia, not only anemia, by seeing your iron levels and your hemoglobin, we need to go deeper, ferritin and other markers, transferrin. So we really go deep into understanding what's going on in your body. Someone has had a heart attack very recently as well because of that same stress and oxidation. We cannot do it right away. So there are some conditions, but basically I would say that maybe 95% or 98% of population can go through an EBOO procedure. Yeah.
Amazing.
I would definitely recommend for anyone. It's a very novel procedure.
Right, similar to dialysis.
It's a type of apheresis. So yeah, because we are definitely using one filter throughout the process. But there are many different types of apheresis and dialysis, and this is one type of apheresis that we're doing combined with the ozone.